Your jaw is throbbing so hard you can feel your pulse inside the tooth. Every heartbeat lands in the same place. Now remove the dentist. Remove ibuprofen. Remove antibiotics. Remove the part where somebody can numb your face. Take an x-ray. Open the tooth. Drain the infection. And tell you exactly what is happening. For most of human history, a bad tooth was not just annoying. Sometimes it was dangerous. A dental abscess can spread beyond the tooth into the jaw, the neck, or the bloodstream. Modern medicine usually gives us several ways to stop that from happening. Ancient humans had none of those guarantees. And that is the first important answer. They did have treatments. They did not have a reliable cure for a serious infection. Sometimes the body contained it. Sometimes a tooth was damaged, drained, lost, or treated in a way that reduced the problem. Sometimes people survived. Sometimes they did not. But long before anyone understood bacteria, humans were already doing things to teeth that look surprisingly familiar. 9,000 years ago, somebody put a drill into a living molar. At Meghar, in what is now Pakistan, archaeologists found several teeth with small drill holes dating to roughly 7,500 to 9,000 years ago. The marks were deliberate. Experimental work later showed that a flint-tip bow drill, similar to tools used for bead making, could produce holes like these very quickly. Some of the drill teeth also showed decay. That makes a therapeutic purpose plausible. We cannot know exactly what the person holding the drill intended. Maybe they were trying to remove damaged tissue. Maybe they were trying to reduce pain. Maybe the treatment had another purpose we no longer understand. But one thing is hard to argue with. They were drilling living teeth on purpose. That is dentistry. Primitive dentistry, but dentistry. And it gets stranger. At Riparo Fredian in Italy, researchers examined two front teeth from roughly 13,000 years ago. The teeth had been intentionally modified. Inside the holes were traces of bitumen and plant fibers. The evidence suggests someone may have tried to treat or seal the damaged area with a crude filling material. Again, we have to be careful. We do not have the patient's appointment notes. We cannot say exactly why the material was placed there. But somebody was doing more than waiting for the tooth to fall out. That matters, because ancient humans clearly understood one part of the problem. Sometimes the tooth itself needed intervention. Unfortunately, bacteria do not care that the tooth hurts less. A cavity and an infection are not the same thing. You can scrape damaged material out of a tooth. You can open a hole. You can pack something into it. But once bacteria have moved deep into the pulp or beyond the tooth into surrounding tissue, the problem becomes much harder. Pain control is not infection control. This is where prehistoric medicine hits a wall. And it is also where one Neanderthal gives us a fascinating clue. At El Sidrón Cave in Spain, researchers analyzed hardened dental plaque from Neanderthal remains. One individual showed evidence of a dental abscess and signs of intestinal illness. Inside the dental calculus, researchers identified evidence associated with poplar. Poplar contains salicylates, compound chemically related to aspirin and known for pain-relieving and anti-inflammatory effects. That does not prove a Neanderthal understood pharmacology. It does not even prove exactly why the plant was consumed. But in an individual who appears to have been sick and in pain, the finding is hard to ignore. Something else appeared in the calculus too. Evidence of Penicillium mold. That sounds dramatic because Penicillium is a genus that later gave modern medicine penicillin. But this is where the story can easily become better than the evidence. Finding Penicillium does not mean Neanderthals had discovered antibiotics. It does not prove they deliberately selected mold to treat an infection. They may have eaten moldy plant material. The mold may have arrived another way. We do not know. Penicillium in the plaque is fascinating. It is not a Stone Age prescription for penicillin. What the El Sidrón evidence does suggest is more modest and, in a way, more interesting. A sick Neanderthal was consuming plants with real medicinal chemistry. Whether that knowledge came from personal experience, observation, or traditions passed between people, we cannot say. But pain relief was possible long before anyone knew what a pain receptor was. And humans kept finding substances that helped. Clove is a later, well-known example. Clove oil contains eugenol, a compound with genuine analgesic and local anesthetic effects. Eugenol-containing materials are still used in dentistry today. That does not mean chewing a clove is equivalent to modern dental treatment. It is not. but it does show how a traditional remedy can have measurable chemistry underneath it. Ancient people did not need the word eugenol to notice that something made a tooth hurt less. Still, none of this answers the hardest part. If you had a real infection, what actually determined whether you survived? Mostly, the same thing that determines whether your body survives many infections without treatment. Your immune system had to contain it. Some infections remained localized. Some may have drained. Some damaged teeth eventually loosened or were physically dealt with. Some people had access to practices that reduced pain or removed disease material. And some infections spread anyway. That is the uncomfortable part. There was no prehistoric equivalent of a reliable antibiotic course. There was no guarantee that bark, drilling, filling, smoke, herbs, or patients would stop bacteria once they moved beyond the tooth. People died untreated odontogenic infections remained dangerous even into much more recent history, before modern antibiotics and surgical care changed the odds. Human survival does not mean ancient tooth infections were easy. It means enough infections stayed limited, enough immune systems won, enough teeth were lost before the infection spread, and enough people survived to keep going. Not every story ended well. That makes the archaeological evidence more impressive, not less, because humans were trying to solve different pieces of the problem without knowing what the problem actually was. They knew pain. They knew swelling. They knew that some teeth rotted. They knew that opening, scraping, packing, chewing, or removing something could sometimes change the outcome. They did not know about bacterial colonies, pulp chambers, anaerobic infection, or antibiotic resistance. They were working from effects. Do this. It hurts less. Do that. The swelling changes. Use this plant. Avoid that one. Try the drill. Try the filling. Keep the things that seem to help. Drop the things that do not. That is not modern medicine. But it is not helplessness either. And it changes the way the question should be asked. How did ancient humans cure tooth infections? Is probably the wrong question. Often, they couldn't. A better question is, how did they improve their chances before they knew what an infection was? Sometimes by physically treating the tooth. Sometimes by reducing pain. Sometimes by relying on plant chemistry they did not understand. Sometimes by losing the tooth. And every time, by depending far more heavily on the body's own defenses than any modern patient would want to. Today, when a tooth starts pulsing, the experience still feels ancient. The pain is immediate. The panic is immediate. The urge to make it stop is immediate. What changes what happens next? A dentist can identify the source, drain an abscess, treat the damaged tooth, remove it if necessary, use antibiotics when they are actually indicated. The invisible part of the problem is no longer invisible. That is the real dividing line. A Neanderthal could dull the pain. A prehistoric practitioner could attack the tooth. Sometimes the body won the infection anyway. Sometimes it didn't. The surprising part is not that ancient humans had secret antibiotics. They didn't. It is that thousands of years before anyone knew what bacteria were, people were already drilling, packing, treating, and experimenting on the exact place where the pain began. Today, when that pulse starts beating inside a tooth, you do not have to hope your immune system wins the argument.